So Chapter 12 covers sedatives, hypnotics, and alcohol. First, we're going to do a little review of the sleep cycle. The normal sleep cycle is divided into two different stages, non-rapid eye movement and rapid eye movement. You'll hear it referred to as REM and NREM. So in stage 1 of non-rapid eye movement, non-rapid eye movement has 4 stages. Stage 1 progresses to 2 and then 3 and then 4. And it's progressively deeper sleep. Stage 1 is the individual is aware of surroundings but relaxed, and the eyes are usually closed. Stage 2 is the individual is unaware of surroundings but can be easily awakened. Stage 3 and 4 are deeper stages of sleep, particularly important for physical rest and restoration. And these 4 stages take about 60 to 90 minutes to complete. So, the mechanism of action of sedative hypnotic drugs. The activity of the brain is in large part dependent upon the action of various neurotransmitters. Each neurotransmitter is released from a specific nerve ending and functions to either stimulate or inhibit neuronal activity. One of the most important neurotransmitters is gamma-aminobutyric acid, or GABA. Much easier to say GABA than it is that long, nasty name. So neuronal function is in large part dependent upon the action of various ions, such as sodium, potassium, and chloride. Each of these ions moves in through or out of, in flux or efflux, the neuronal membrane through specific ion channels. So nerve action potentials are inhibited or stopped when chloride ions come in through the channels. And the neurotransmitter that regulates the chloride ion channels is GABA. When GABA binds to its receptors, the channels open and the chloride ions come into the nerve, causing hyperpolarization. This reduces the generation of action potentials and inhibits the nerve. So hypnotic drugs increase GABA receptor-mediated chloride influx by binding to their specific drug receptor sites on the chloride ion channel. So barbiturate sedatives and hypnotics. At higher doses, they cause depression of CNS. They increase stage 2 sleep, decrease stage 3 and 4, and they can suppress REM sleep. At lower doses, they promote sedation or sleep, just not to the effect of the higher doses. So let's see. Just hypnotics, barbiturates usually increase. When barbiturates are discontinued, patients often spend excess time in REM sleep during the next night or two to make up for the lost REM sleep from its suppression. So that's called REM rebound. The barbiturates are well absorbed following oral administration. Once in circulation, these drugs are distributed to all tissues. Symptoms of CNS depression occur within 30 to 60 minutes following oral administration. Enzyme induction that you see on slide 9, that refers to an increase in the amount of drug metabolizing enzymes in the liver. Enzyme induction usually results in faster metabolism of the barbiturate. Therefore, the duration of action is decreased, and the patient must take increasingly larger doses to achieve the same effect. Phenobarbital is classified as a long-acting barbiturate. Pentobarbital is intermediate acting, and a short-acting one would be secobarbital. Adverse effects of these medications include drowsiness, dry mouth, lethargy, and the ability you lose coordination. Elderly patients are particularly sensitive to these CNS side effects, so we want to be careful with these drugs in the elderly population. Prolonged and excessive use can lead to tolerance and physical dependence, and there can be cross-tolerance to other CNS depressants such as benzodiazepines. Overdose with barbiturates can result in extensive cardiovascular and CNS depression, and in large doses, these drugs can cause hypotension and shock, and there's no antidote for them. Again, want to be super careful with these medications when patients are taking them. So barbiturates are contraindicated in patients who have something called porphyria, as well as pregnant women, more importantly pregnant women. You don't see a lot of patients with porphyria. Pregnant women you do see a lot of, so no barbiturates for our pregnant women. Sedative hypnotic agents will potentiate the actions of other CNS depressant drugs, such as pain medications, which can lead to greater CNS and respiratory depression. Alcohol and sedative hypnotics can also be a deadly combination. Again, they decrease the respiratory and cardiovascular response. So always want to be careful with these patients, reminding them nicely not to drink while they're taking these medications. Moving on to the benzodiazepines, a fun little class of drugs. Commonly referred to, a lot of them sound just like that: diazepam, clonazepam, alprazolam. They all sort of sound the same. They are a class of drugs widely used in the treatment of anxiety, and they were commonly referred to as anti-anxiety drugs. They produce sedative and hypnotic effects by increasing the inhibitory activity of GABA. They bind to the receptor sites, or also known as BZD receptors, that are in close relation to the GABA receptors. And the combined action of GABA and the benzodiazepines increases the frequency of chloride ion channel opening, again resulting in hyperpolarization of the membrane and reduced neuronal activity. So this causes, in the reticular activating system, this causes sedation or hypnosis. So they're well absorbed after oral administration. They cross right over that blood-brain barrier because they are lipid soluble. Some of them are metabolized to their active form, which produces sedation and hypnosis for a longer duration of action. Unlike the barbiturates, benzodiazepines do not cause enzyme induction, so they don't require higher and higher doses usually. They're classified as well by their duration of action: long-acting flurazepam, intermediate-acting temazepam, short-acting triazolam. They increase stage 2 and decrease stage 4 sleep, no depression of REM, so no REM rebound. There are a few side effects when used properly, and there is an antidote, so that's the good news. The antidote is called flumazenil, brand name Romazicon, and it is used to reverse the effects of benzodiazepines. Again, not to be used in pregnancy. Same problem with potentiating the actions of other CNS depressants, and they interact with cimetidine. Cimetidine can cause them to stick around for longer because it inhibits their metabolism. So that means that we want to possibly think about a decreased dose, or possibly separating the two drugs, or not taking cimetidine at all, finding another drug. Miscellaneous hypnotic drugs. These have diverse chemical structures and pharmacological characteristics and don't necessarily fit into one class or another. They selectively bind to a subunit of the benzodiazepine receptor and again increase the inhibitory effects of GABA. They do not interrupt the sleep cycle like benzodiazepines and barbiturates, however. Some examples as zopiclone, Zaloplan, Zolpidem, usually used for sleep, individuals that are having difficulty falling and staying asleep. So, common effects include dizziness, headache, dry mouth, memory impairment, same CNS sort of side effects that we're going to see in the other medications. Slide 16 talks about frequently prescribed hypnotic drugs. Again, you don't have to be familiar with the half-life. You might want to be familiar with the duration, but you don't need to memorize doses, half-lives, etc. Last but not least, alcohol. Alcohol is probably the most widely used, self-prescribed, a non-prescription sedative, hypnotic, and anti-anxiety agent. That's why they call it the social lubricant. After drinking alcohol, there are several effects to the body, including depression of the excitatory and inhibitory fibers of the brain, dilation of blood vessels, which is why we become red, increased appetite, increased excretion of urine, and decreased coordination. So acute alcohol adverse effects include inebriation, which is extensive CNS depression. Chronic consumption can lead to progressive changes in cell function, liver damage, and physical dependence. Treatment for alcohol dependency is disulfiram, and what it does is it interferes with the metabolism of alcohol, and if the patient drinks alcohol while they're on it, it produces almost instant hangover, nausea, vomiting, headache, and hypotension. It makes them feel awful. So it's supposed to sort of give them that negative reinforcement to prevent them from drinking again. That covers Chapter 12. Pretty interesting stuff, a lot of common medications, many of them controlled, so if you do choose medications from this chapter, make sure you remember to look up their controlled medication class that's in your nursing manual. Okay,